Welcome back to the web series of Cardiovascular System. Cardiovascular disease is the leading cause of death for both men and women. It includes a broad range of conditions and diseases, some of which are genetic and many of which are the result of lifestyle choices. There are many different types of diseases that can affect the heart and vascular system. Through this web series, we discussed about different types of cardiovascular diseases. Coronary artery disease. Coronary artery disease is a type of blood vessel disorder. It causes impaired blood flow in the arteries that supply blood to the heart. Coronary artery disease is a general category of atherosclerosis. It refers to the narrowing or block of the coronary arteries. Angina pectoris. It is a clinical syndrome characterized by episodes or paroxysms of pain or pressure in the anterior chest. The cause is usually insufficient coronary blood flow. Infective endocarditis. It is the infection of the inner lining of the heart caused by direct invasion of bacteria or other organisms that it causes myocardial abscesses or heart failure or other complications. Rheumatic heart disease. Rheumatic heart disease is a chronic condition resulting from rheumatic fever, which involves all the layers of heart and is characterized by scarring and deformity of the heart valves. The commonest valves affecting are the mitral and aortic valves. Cor pulmonale. It is the failure of the right side of the heart caused by prolonged high blood pressure in the pulmonary artery and the right ventricle of the heart. Pulmonary hypertension is usually a pre-existing condition in the individual with cor pulmonale. It is also known as right side heart failure. Pericarditis. Pericarditis is a condition caused by inflammation of the pericardial sac which may occur on an acute basis. Cardiogenic shock. Cardiogenic shock is a failure of the heart to pump blood adequately to meet oxygenation needs of the body, which occurs when either systolic or diastolic dysfunction of the pumping action of heart result in compromised cardiac output. Hypertension. Hypertension is one of the most common lifestyle disease to date. It affects people from all walks of the life. Hypertension is defined as a systolic blood pressure greater than 140 mm of mercury and a diastolic pressure of more than 90 mm of mercury. This is based on average of 2 or more accurate values of blood pressure during 2 or more consultations with the healthcare provider. Hypotension. Hypotension refers to low blood pressure. Systolic blood pressure less than 90 mm of mercury and diastolic blood pressure lower than 60 mm of mercury is considered as hypotension. Low blood pressure which can cause fainting or dizziness because the brain does not receive enough blood. Myocardial infarction. It refers to the process by which areas of myocardial cells in the heart are permanently destroyed. Myocardial infarction is a disease condition which is caused by reduced blood flow in a coronary artery due to atherosclerosis and occlusion of an artery by an embolus or thrombus. It is estimated that up to 90% of cardiovascular disease may be preventable. Prevention of cardiovascular disease involves improving risk factors through healthy eating, exercise, avoidance of tobacco smoke and limiting alcohol intake. Treating risk factors such as high blood pressure, blood lipids and diabetes is also beneficial. Here ends the web series of Cardiovascular System.